Hi, it's Dr. G, Specialist Medical Doctor and PhD in Midlife Women's Hormones. I just wanted to touch again on progesterone cream and the fact that it is a very useful intervention in midlife and perimenopause for what many of us describe as low progesterone symptoms. Remember, they are feeling anxious, feeling on edge, sleep disturbance, a worsening of or an increase in intensity of premenstrual symptoms, low libido, and sort of clotting in the menstrual flow. Many of my midlife patients feel their symptoms are significant and really appreciate it when they get some supplemental progesterone. And I often use progesterone cream. It seems to work overall better than even the tablets. Now, the reason being, the cream, when applied, doesn't go into the blood, but it tends to go into the fat tissue layers below the surface of the skin, into the lymphatics, and then into the tissues. And we don't have much data on how it works this way, but I tell you what, in my practice it works. So what do? You're using 3 to 5% progesterone cream, and you put it, I recommend putting it on at night around here on the body and using it every night apart from those nights that you're having a menstrual period. You don't want the progesterone in the cream to interfere with the sloughing off of the endometrial lining. Now, to work out whether it's actually working, I find it works within 1 to 2 weeks in most women. But it's fair enough to try it for 3 or 4 menstrual cycles before you decide, oh, it's not working and I don't need it. And how long into your transition to menopause would you need it? Well, it certainly depends on what other symptoms start to come up. Are you going to get symptoms of high estrogen or low estrogen as you go through the perimenopause or the transition to menopause? And it's something to keep an open discussion going with your healthcare provider. I certainly find it very useful, and I find I don't need it for more than a few years before you're moving on to the next step through the perimenopause transition, and it is a very safe intervention and very useful. So see if you can find a practitioner who's experienced in the treatments and of progesterone cream and all the other kinds of progesterone. Hope that was helpful. See you next time.